for each and every patient. This is done after every 6 months. Apart from that, we also do other liver function tests like the bilirubin and the GOT. This also helps in monitoring the liver functions, how the liver functions and how the kidney is functioning. And it helps the clinicians to check if the drugs the patients are using is helping them. Hello viewers, my name is Lydia and I work in the laboratory. I just want to give a highlight on what tests we do in the laboratory. In our routine tests, for our patients we do mainly TB tests, and this is done for patients normally who are suspected to be having TB. This is based on the clinical symptoms like sweating at night, coughing for more than 2 weeks, and other symptoms. We normally emphasize on how to collect the sputum samples for our patients. We give the patients 2 containers for the sputum sample, and then we advise the patient on how to collect them. We advise the patient to collect a spot sample which is collected at that time the patient comes to the laboratory, and the second sample is collected the following day in the morning before the patient takes anything. That is, before the patient eats anything. This sample is supposed to be collected outside from the laboratory, and we advise the patient not to to cough amongst other patients. So we advise the patient to go to an open place and take the sputum sample and bring it safely to the laboratory. The following day's sample is brought to the laboratory at 8 o'clock in the morning. And we also advise our patients to make sure that the second sample is brought to the laboratory so that whoever is processing the sputum should process 2 samples, failure to which the sample that has been collected, just the spot sample, will not be done. And this is to avoid the multi-drug resistant TB, that is MDR. Alongside the TB or the sputum tests, we do other tests like malaria, urine analysis, stool analysis, rheumatoid factor, full blood count, and many other tests that the clinician or the doctor may see it possible or important for the patients. That's basically what we do in the laboratory, and you're most welcome. Thank you.
Hello, I want to talk about the triage. Well, the triage is the entry point of every patient as they come to the clinic. The triage basically means we prioritize the patient's needs as they walk into the clinic. The patients are basically registered as the cards are produced as they come to the clinic. Well, every patient has different needs when they come for the appointment. They could be coming for a CD4 test. They could be coming for their vincristine. They could be coming for clinical review. They could be coming for treatment preparation sessions, counseling, among other needs. Well, at the triage also, we also have the vital signs being taken, where we have the blood pressure, the temperature, the weight of the patient, and the height, especially for the children, to monitor their growth and progress. Also, at the triage, we have the adherence status of the patient being monitored at every visit. Here, we use what we call an adherence percentage, which is calculated from the pills that the patient comes with, what we call the pill balance. Also, we have an adherence chart, which is charted at every visit where the patient comes into the clinic. The key emphasis during adherence settings, we're talking about the punctuality of as the patient comes into the clinic. we're talking about how prompt the patients come in regards to the expected date of return to the clinic. We're also talking about the pill counts. Does the patient miss drugs or not? We also talk about safe sex and disclosure for the patients and for their partners. Also, we have scheduled lab tests, for instance the CD4 tests, which are scheduled every 6 months, and the sputum for the patients that are on ongoing TB therapy. Well, the key advice here when we talk about adherence and the triage is, first of all, the patient should take treatment as their own responsibility. The patient is also expected to know all his or her medications, so that even if the patient fails to come to the clinic, they can walk into the nearest clinic, say they are up country, and they're able to ask for their refills as often or as promptly as they can. We also encourage disclosure to the partner or to the spouse, even to the siblings and to the children. This helps the patient to get a treatment buddy and also to be reminded to be coming to the clinic to monitor adherence basically. Thank you.
Okay. Welcome to this session whereby I'll be telling you or informing you on the prevention to mother transmission of HIV. When we talk of prevention of mother to child transmission, in this case I'm talking of the vertical transmission. HIV can be transmitted from the mother to the child in various ways. Number one, the virus can be transmitted in utero. That is, the mother transmits the virus to the unborn child in the uterus. And this basically happens when a mother who is HIV infected probably is not on medication and has got very high viral loads. Though the percentage of transmission in utero is minimal, but it's better to take precaution than actually giving birth to a child that is HIV infected. Number two, transmission can also occur during delivery, and that accounts for a very high percentage. Yeah? So it is imperative that a mother that is HIV infected during this time and period of delivery, a lot of precaution is taken to ensure that minimal contact between the unborn child and the mother's secretion don't come in contact. A lot of precautions. And number three, transmission can also occur during breastfeeding. So this period of delivery and the period of delivery up to breastfeeding period, it's actually a very delicate period and time, and we expect that mothers uphold all that community health workers instruct them, or rather brief them to ensure that their children are not infected. So according to the guidelines, all pregnant women fundamentally should know their HIV status. I think that is the most core important thing. And all ANC mothers, all ANC attending mothers should and are being tested for HIV. That is universal across, it's everywhere across the country, I believe, and I also believe it's practiced globally. That's according to WHO. And if a mother is found to be HIV positive, according to the guidelines, at 14 weeks of gestation, that mother is put on drugs, that is antiretrovirals, to prevent the child from acquiring the virus. But this is done depending on the CD4 count of the mother. Take at this scenario, if a mother has got a CD4 count of less than 350, the mother is put on full antiretroviral therapy. What do I mean by full antiretroviral therapy? Antiretrovirals are given in 2 different classes, and they should be total full three drugs, yeah, to ensure that we suppress the virus and reduce the viral load in the mother, to minimize the chances of the mother transmitting the virus into the unborn child. But a mother who has got a better immunological count, for example, a CD4 of more than 350, a single drug is started at gestation 14 up to when the mother gets into labor, and from labor the doses are doubled and another antiretroviral is added and proceeded, and the drugs are proceeded for a week. Then from there the mother is stopped and their child is now given medication as prophylaxis. For as long as the child is breastfeeding, the child should be given prophylaxis, just to ensure that we avoid transmitting this virus in the child. Remember, the child will be breastfeeding. The same virus that is in the system, for example, also circulates in the breast milk. So that is the reason as to why we give antiretrovirals to all mothers. But the take-home information for all mothers is that it's better, if you are HIV infected, to consult your clinician when you are pregnant, because there are the do's and don'ts during pregnancy period, especially for mothers that are HIV infected. Number one, it's important for all HIV infected pregnant mothers to attend their ANC clinic, their antenatal care clinic. Very important. At that point, the clinician will be assessing on the progress of the mother. And it's at these visits that the clinician will be giving drugs to prevent the mother from transmitting infection. Therefore, attending ANC clinic, very fundamental. Number two, the mother should ensure that they are taking their antiretrovirals as prescribed and always. Remember, during this time of pregnancy, most of the mothers will have hyperemesis, they will have nausea, but we should encourage them to take these drugs. It's very important, during this period, to ensure that they take the drugs, to ensure that they suppress their viral loads to the bare minimal level to avoid transmitting the virus to the unborn child. It's also important for the mother to have a plan, a birth plan. Where will the mother be delivering? We are trying as much as possible to discourage home deliveries and deliveries on by traditional birth attendants, probably who don't have even the know-how on how to manage a patient who is on delivery, yet she's HIV infected. The management at that period is very delicate. So we encourage all mothers to deliver in a hospital setting that is government approved. Very important. Number three, on delivery, the mother should ensure they bring the child for assessment to the clinic, accompanied by their ANC card, and also the mother should have opted for a feeding option. And the best feeding option in this case is exclusive breastfeeding. Exclusive breastfeeding for 6 months, then from there, complementary feeding can follow. During this time of breastfeeding, if the mother is on antiretrovirals, we expect that the mother has suppressed all her virus to the mere minimal levels, so we expect that they are undetectable virologically, so they can breastfeed comfortably. Then from there, the mother should complement the breast milk, and it said even up to 2 years. But at that point in time, the risks of transmitting the virus are actually minimal. So, what do we say? We're informing all our mothers and mothers-to-be that they should take precaution and ensure they are there to clinical guidelines, and they ensure to clinical advice from the professional healthcare workers to them, because it is important that we give, or rather get, children that are HIV negative. Having said all this, remember that your health is your responsibility. Thank you.